All right, today we're talking about a tiny organ that can cause some huge problems. I'm talking about the gallbladder. We're going to follow the journey of a gallstone, from the moment it's created to when things can get, well, pretty complicated and even dangerous.
Okay, I'm going to start with a number, and I bet it's going to surprise you. 80%. So what do you think that number represents?
Yep, it's the number of people with gallstones who have no idea they even have them. That's a staggering 4 out of 5 people. These little crystals are just hanging out in their gallbladder, not causing any trouble at all.
So that's the big question, right? When does this silent partner become a really painful problem? That's what we're going to dig into. We'll follow the path of a gallstone to see exactly how it goes from being a harmless passenger to a major troublemaker.
Okay, first things first, let's get some context. Gallstone disease, or if you want to get technical, cholelithiasis, it's incredibly common. We're talking 10 to 15% of people in Western societies. But like we just said, for most of them, it's not a big deal. So to figure out when it does become a big deal, we got to start with what these things are even made of.
Right, because not all gallstones are the same. Not at all. They've got different origins, different ingredients, different risk factors. You can kind of think of it like a recipe.
And the breakdown is, well, it's pretty striking. The vast majority in Western populations, a full 80%, are what we call cholesterol stones. That leaves the other 20% for what are known as pigment and mixed stones.
So let's break down those two different recipes. On one hand, you've got cholesterol stones. These form when the bile in your gallbladder gets, well, supersaturated with cholesterol. Basically, there's just way more cholesterol than the bile can keep dissolved. Things like diet, obesity, even some medications can trigger this. And if your gallbladder isn't squeezing properly, that stagnant bile is just the perfect environment for crystals to form and grow. Now, on the other hand, you have pigment stones. These are totally different. The black ones, they're linked to conditions where you have super high levels of something called bilirubin. That's a waste product from old red blood cells. That's why you often see them with things like cirrhosis or sickle cell disease. And then the brown stones, they're more rare, and they usually form right inside the bile ducts themselves, often because of a chronic infection.
So for years, sometimes even decades, these stones can just sit there, doing absolutely nothing. The trouble really starts when one of them decides to, well, go on a little journey, and it gets stuck somewhere, causing a blockage.
And that blockage? That leads to the #1 symptom, which is called biliary colic. Now, the key thing to understand here is that this isn't some quick, sharp cramp. No way. It's a deep, dull, and really severe continuous pain. And it's happening because your gallbladder is squeezing with all its might to push out bile, but that stone is blocking the exit, like a cork stuck in a bottle.
The telltale signs of one of these attacks are pretty classic. We're talking a severe pain in the upper right side of your abdomen, and sometimes it can even wrap around to your back. It can go on for hours. And a really common trigger? A fatty meal. See, when you eat fatty foods, your body releases a hormone that tells the gallbladder to contract and contract hard. And that just shoves that lodged stone even more forcefully against the opening.
So when someone comes in with this kind of pain, doctors have to figure out what's going on. They need to confirm that it's actually gallstones and see exactly what's happening inside.
And for that, they've got a specific toolkit. The first stop, and usually the best one, is an ultrasound. It's quick, it's not invasive, and it's super accurate at spotting stones. They just look like little bright spots with a telltale shadow behind them. Now, if the doctors think a stone might have escaped into the main bile duct, they'll turn to something called an MRCP. It's a special kind of MRI that gives them a really detailed map of the whole system. And finally, there's a HIDA scan. This is a type of nuclear medicine scan, and it's great for confirming if the gallbladder's exit is actively blocked, which is a big sign of a serious complication.
And this is where the whole journey can take a really dangerous turn. A simple blockage can escalate, and I mean really escalate, into serious, sometimes even life-threatening complications if it's not dealt with.
You know, there's a great analogy to help us wrap our heads around this. Think of your entire biliary system, all those ducts, as a specialized highway system. And gallstones, well, they're the potential traffic jams.
So, the most common complication is something called acute cholecystitis. In our highway analogy, this is like a bad crash that completely blocks an exit ramp. A stone gets totally stuck in the gallbladder's owned personal exit, the cystic duct. Bile can't get out, pressure builds up, and the gallbladder gets inflamed and infected. There's even a classic clinical sign for this, called a positive Murphy sign. It's when a doctor presses on the area and the patient just has to stop breathing in because of the pain.
But things get way more serious if that stone gets out onto the main highway,
the common bile duct. Now we're talking about a complete highway shutdown. It blocks all the bile flowing from the liver, causing it to back up into the bloodstream. This is what leads to jaundice, that yellowing of the skin and eyes, and it can trigger a really severe, life-threatening infection of the bile ducts called ascending cholangitis. This is a true lights and sirens medical emergency.
And then there's the pileup at a critical intersection. See, the common bile duct shares its final exit with the pancreas. If a stone gets wedged right at that junction, it can block the pancreatic fluids too. They back up and literally start to digest the pancreas itself. This is called gallstone pancreatitis, and it is incredibly dangerous.
I mean, it really shows just how much chaos one tiny stone can cause. And there are even rarer, crazier complications, like Miritzi syndrome, where a massive stone inside the gallbladder just physically presses on the main bile duct from the outside and blocks it. Or something called gallstone ileus, where a stone actually wears a hole through the gallbladder wall, gets into the intestine, and then causes a bowel obstruction way downstream. Just wild.
Okay, so after all that potential chaos, how do doctors actually fix the problem? Let's get to the final stage of this journey, evicting those stones for good.
Well, the modern gold standard solution isn't actually to remove the stones. It's to remove the place where they form. We're talking about a laparoscopic cholecystectomy, which is a minimally invasive surgery to take out the entire gallbladder. This way, no more stones can ever form and cause trouble. Plus, it's way less painful and has a much quicker recovery than the old-school open surgeries.
Which, of course, brings us right back to that 80% we started with. If the huge majority of stones are silent and not causing any trouble, do you actually need to do anything about them?
And generally, the answer is no. Prophylactic or preventative surgery isn't recommended, simply because the risk of a silent stone ever causing a problem is actually pretty low. Now, there are a few exceptions for specific high-risk situations, like if a stone is really, really large, or if the gallbladder wall has become calcified and brittle, a condition called porcelain gallbladder, which increases cancer risk, or in patients with certain blood disorders like sickle cell disease.
But for someone who's in the middle of an acute attack, the path forward is very clear. Step 1, they're admitted to the hospital and stabilized with IV fluids and antibiotics. If there's a stone blocking the main bile duct, that's often removed first with a special procedure using an endoscope called an ERCP. Then, once the patient is stable, the recommendation is to get that gallbladder out with surgery, ideally within a week. Now, for patients who are just too sick to handle surgery right away, a temporary drain can be placed to relieve the pressure on the inflamed gallbladder first.
So when you think about it, from a totally silent passenger to the cause of a complete systemic shutdown, the journey of a gallstone is a pretty powerful reminder of just how interconnected our bodies are. The gallbladder itself is small, but the problems it can cause are huge. And that really leaves us with a final thought, doesn't it? What does the story of this tiny organ teach us about how important it is to listen to the signals our bodies are sending us?